Great. Dr. Allen.
First, a correction. I am an assistant medical director for physician recruiting. I have been in the distant and terrible past the full medical director, but we have a very competent man now. When Nicole talked to me, she said, I'd like you to talk about the problems in healthcare, and then I'm going to give you 5 minutes. And I said, 5 hours would be reasonable, but 5 minutes is not, and yet I will do the best I can. When we say the system is broken, it's terrible, it doesn't work, and it's too damn expensive, the question comes up, compared to what? Well, there's an organization called OECD, and I've never been able to figure out what that means, but it's a collection of nations like ours. They are democratic, they survive in a free enterprise world, they are first world industrial countries, and they publish a lot of information of all the members, of which we are one. And so we're going to compare ourselves to the average of these groups that are mostly Western European, but also Australia, Canada, and so forth, and we are there. When you look at the data, there are 4 things that they do that we do not. Number 1, they cover everybody. We have never been able to do that. The best we've been able to do is about 90%, which means that 30 million people go to bed every night without assurance that if they get sick, they will be taken care of. Or if they will, they're going to go broke. There are studies that tie in coverage with lifespan, and the figures come out roughly this, that roughly 40,000 people each year die in this country because they do not have access to health care. Now stop and think about that. And yet that is not just a bad thing, it's not a tragedy, it's a damn crime. And yet we allow it. So they cover everybody and we don't, and then surprise, they do it at 30% less than we do. That's a true fact. In France, take Canada. The percent GDP is at about 11%. Our percent GDP is pushing 18%. So how can they do that? The third thing is, you think, all right, they're cheaping in on care. They don't give the care they should. The facts show otherwise. These people, on the average, see the doctor more commonly than we do. They spend more time in the hospital than we do. So it's not that they're cheating care, it's the system. And the system of how we finance and how we administer medical care, and we are sadly behind the times. The fourth thing is the population. It turns out when you ask people in Sweden, Canada, and so forth, do they like their system? Nobody likes their system. And it also turns out that in America, we like our systems less well than the rest of the world does. And, surprise, the most popular of these is Medicare. Now, the question is, if we're so bad, what are we going to do about it? How do we get from here to there? It's very simple. You change your government. And that's what we're here tonight about, trying to get someone in who's been brave enough to use those simple words, single payer, in his information. It used to be a dirty word. You were a left-wing nut if you thought that's possible. There are still some people that think that. But in fact, it turns out, what is the common line in all these other countries that allows them to give good care at lower cost with better outcomes? 2 words, single payer. Single payer means that the government is responsible for seeing that, not necessarily providing, but for seeing that medical care is given to all. Now, about half these countries do have where the doctors are salaried and the hospitals are owned by the government. But Canada is a good example of the reverse, where the doctors are free to go where they want, hospitals are free, but the system, who finances it, who pays for it, taxes, yes, but premiums go down as taxes go up, and costs go down. It can be done. There are people who say it's not possible, but it has been done in a number of nations, and it's clearly the way to do it. But the only way to do it is to change the system, and that's not easy. We have a chance, maybe, to capture the House. We may have to wait a while before we capture the rest of it, but there are now in the state, I'm understanding, about 150 people who have signed in who are in the House of Representatives, who signed on to the single-payer system, and Josh Harder has been one very definitely in favor of that, and for that reason I would suggest you consider very seriously that you vote for him, which if I could vote twice, I would do it. But there's a law against it. But that's basically what I have to say. Go do your duty at the polls. That's the only way we're going to make change. Thank you.